We've had to completely redesign our entire emergency department. We've redesigned triage so that as patients come in, we can immediately identify who may have COVID-19 and who may not. We designed an entire tent area. There's 3 tents actually, and a 4th one for outside imaging, so that patients that are otherwise stable can be seen quickly, they can be assessed quickly, and we can facilitate their care. We've designed areas in the emergency department for more critically ill and symptomatic COVID patients.
We've done a great job of getting extra personal protective equipment to try to keep us safe in the meantime. And as a team, we are all trying extra hard to pick up shifts when needed, when people get sick, and make sure that we always have the staffing to take care of our patients safely and effectively.
We want to make sure that patient care goes smoothly. We want to make sure that everything's efficient. So if tests are needed, we make sure that the right tests are done up front. Procedures are needed, we're going to support the ICU to the best as we can.
The number one message I would give to people about it is that it's contagious and you can do your part to prevent deaths and severe illness.
So many people will be exposed to this disease, and the majority of those people will come out at the other end doing just fine. We need to remember the people who won't. We need to remember our grandparents, our loved ones, our friends and family who have chronic illnesses. We need to stay home so that they can fight harder for their lives.
We've seen a complete age range. We see the youngest, I want to say, is 20s and as old as 90s. It touches everybody. It touches all ages, touches all genders. It's touching everybody in the community.
And unfortunately, right now, family and loved ones aren't at the bedside because of their risk of disease exposure.
So one of the things our hospital has been doing to help connect the patients and the family is we're using FaceTime. We're using pads for that. And so the patients are at least able to see their family members and have that communication and touch with them. Another thing that the nurses are doing, which is pretty special, is even in their full garb, they're going in there holding the patient's hands, being as comforting as possible, letting them know they're not alone, and letting them know that we're there doing everything we can to help them.
Right now, I find that as a team, we're taking a little bit of extra moment to say, how are you today? Are you doing okay? Sort of checking in on people when you have a moment to do so.
I continue to see the Cedars Sinai spirit, which is kindness, courtesy, respect. I see smiles. I see us being compassionate and caring for people and reassuring them and comforting them.
The community surrounding Cedars Sinai has been just so amazing and generous throughout this entire pandemic. We have been getting an incredible amount of support, both with food, always giving us nourishment so we can continue our shifts feeling strong.
We have a moment to sit together and eat something and both recharge our bodies and also sort of recharge our minds and commune for a second before we get back to work.
We have had amazing support from the community. We have received so much food for not just the emergency department, but for the hospital.
We have always been there to take care of people when they're at their most vulnerable and when they're feeling the sickest and the most scared. And even when this pandemic's over, we'll continue to be there to take care of people.
All along the way, the staff has just been amazing. They have great attitude. They're all absolutely superstars. And they're all, they get it. We're all, getting ready for a bigger battle. And the battle's already started. So far, so good. We know we're going to continue fighting this, and it's going to get more and more challenging. And they're ready. They're ready to go.